Welcome to ThinkTech on OC16, Hawaii's weekly newscast on things that matter to tech and to Hawaii. I'm Jay Fidell.
And I'm Alisa Onishi.
In our show tonight, we'll cover the HVCA ThinkTech luncheon program that asks the question, how healthy is healthcare in Hawaii?
It was one of the best we've ever done and featured Senator Josh Green and Ginny Presller of Hawaii Pacific Health and their two excellent panels on the costs and quality of healthcare in Hawaii.
We put the program on last week, and it was very well attended. Hundreds of people showed up from the business and healthcare communities, ready to listen to the healthcare leadership and ask hard questions.
First, there were remarks from Bill Spencer and Jay Fidell opening the program.
Welcome to the Hawaii Venture Capital Association ThinkTech Hawaii program on how healthy is healthcare in Hawaii.
What effect does the level of care have on the economics? And what effect does the economics have on the level of care? And what is the right balance? No small question. Our health individually is at stake, the health of our community is at stake, and the health of our economy is also at stake. Then we heard from Ginny Presller, Executive Vice President of Hawaii Pacific Health, moderator of the first panel.
The first panel, discussing the economic transformation of healthcare in Hawaii, included Bruce Anderson, Coral Andrews, Beth Giesting, and Thomas Tsang.
We'll try to give a little insight to all of those issues that Jay has brought up. Let me start by making a few comments related to the economic transformation of healthcare before we get into our panelists. I think all of those of you here today are familiar with the OECD. That's the 34-nation Organization for Economic Cooperation and Development. They just came out with their most recent study on the comparative data on quality and cost of healthcare in these 34 OECD nations. And by every measure, the United States pays more for its medical system, more dollars per person, a greater percentage of gross domestic product, and higher prices for doctors, hospitals, and administrative costs and drugs. The U.S. spends anywhere from 2 to 3 times as much as the average for the other OECD countries. Total health care spending in the United States costs about $8,000 per person for health care.
My word for the day is essential, in that healthcare is essential to each and every one of us as consumers and payers, but the costs are dragging down our economic flexibility and our future. So we're not even getting very high quality care consistently. So it's essential that we fix the system as soon as possible. Beyond why healthcare is so important to us each individually, the economic part, the part of our economy that healthcare is taking up is just unsustainable and growing out of control. And as Ginny mentioned very succinctly, was the quality is not always there for us. So when we're looking at what we need to do about this, first we need to see how our healthcare system differs from other parts of the economy. So imagine any other part of the service sector that continues to grow while essentially ignoring its customers. The healthcare sector is largely created for the convenience and the benefit of providers, insurers, and the professionals in healthcare. There is almost no information that's available to consumers about cost and quality. Even when consumers get information from their insurer and provider, they may not know what to do with that information or understand what it is.
My one word is innovations. So my role is to advise the governor and advise the Office of the Governor and the Office of Healthcare Transformation about all the best practices across the country, including technology innovations as well as systems innovations and changes that are going across the national landscape, and what we can bring in and adapt for, at least for the state of Hawaii, and to really prepare Hawaii to be the top, not number 4, but to be the number 1 state in healthcare in the country. So that's my role. So a little bit about what I want to talk about in terms of innovations. I think this is a huge, huge opportunity at this juncture in time. As Rahm Emanuel said, let not us waste a crisis. I think it's embedded in the American culture. I think it's embedded in our American gene pool that when we do have a crisis, we take advantage of it, and we create, and the pressure creates innovations. I mean, it's not a surprise that the rest of the world is using Google and Apple products and Facebook, and there's something to be said about American ingenuity and capitalism and how the market actually creates and nurtures innovation. So I think this is a room full of innovators here, and I think there's lots of opportunities for you guys to take part of.
So my word is the connector. And as I talk about the health insurance exchange, which is otherwise known as the connector, I really view it, and Tom's comments segue into it nicely, that it's a place where all other things will come together. So connector, that's my word. Thank you. Because the health insurance exchange is relatively new, part of my 5 minutes is going to be dedicated to doing a bit of a 101. So if you'll bear with me, I'm going to build up to getting into a little bit more of maybe where the venture capitalist interest may lie. But the Health Insurance Exchange was created as the Hawaii Health Connector out of the 2011 legislative session. And we're unique in Hawaii if you look across other states because our state stood it up as a private nonprofit. It has created some interesting machinations in being able to move money to support the private nonprofit, but we're getting there, and I think that the idea behind it is to enable us to be fast on our feet, and we have great partners at the table in helping us to do so. We've talked about the federal health reform bill, a lot of different names for it, Obamacare, Affordable Care Act, so ACA is usually the acronym you hear among healthcare folks, but the idea behind federal health reform was to create greater access to care and to expand coverage. And the Health Insurance Exchange is an opportunity for us to be able to create access to health care utilizing technology like Dr. Tsang mentioned.
I think the single word that best summarizes what we do is safety net. Actually, that's 2 words. I cheated. But I'll give you my 2 cents worth anyway on what I think some of the issues are that we're trying to deal with. Hawaii Health Systems Corporation, we call it HHSC, is the safety net health care system in the state of Hawaii. We provide emergency services and other essential services to the uninsured, the underinsured, those on Medicaid, and others with special health care needs. There are many other facilities which I think of themselves as safety nets, but our business is really to keep our doors open and make sure that people in Hawaii have the services they need. In many areas, particularly the rural areas, we're the only provider of health care. We work in partnership with physicians and clinics and others in all these communities, but we are the most important and largest provider of care on most of the neighbor islands. And in fact, HHSC is the 4th largest public health system in the United States. People don't realize that, but it's a very large system by any standard. We're consisting of 13 medical facilities. I'm going to share with you a little bit about what we are, because people on Oahu often don't know about HHSC unless they've driven by Leahi or Malahia. But we do provide care on most of the islands. West Hawaii, East Hawaii, Maui, Oahu, and Kauai are separate regions in the HHC system. Each are very different and have different health care needs.
Then we heard from Josh Green, State Senator and Chair of the Senate Health Committee, moderator of the second panel.
The second panel discussing the delivery of healthcare in Hawaii included Jerris Hedges, Hilton Raethel, Nadine Tenn, and Art Ushijima.
So, does the healthcare system work in America? Well, it works for a lot of people. Let's be candid about that. It does work for a lot of people. But we're talking about also who it doesn't work for. It doesn't work for the working poor very well. It doesn't work for children that live below the poverty line. That's one large group. And it doesn't work for the solid part of the middle class that has really serious health problems that are extremely costly and pushes them over the edge. So keep that in mind. So it does work for a large number of people in our country, but the numbers have swelled to a degree where, because too many people aren't getting adequate health care, it both crushes them in their lives, and the impact on our economy is gigantic. One thing to keep in mind also, because this is a group that's very focused on economics as well as a humanitarian address of the health problem, that in 2001, America spent $1.3 trillion on healthcare. In 2011, we spent $2.6 trillion in healthcare. Doubled. So what does that tell you? It tells you that there's incredible expansion. It also tells you that there's an incredible opportunity to get involved in solutions. And it also tells you that that number could continue to grow, and therefore people should be very attentive from a business model standpoint of helping to be part of the solution, because it's a good place to have a career and to help people.
And my word is transform. I'm hoping that we will inspire you and others to really transform what we're doing. I want to talk a little bit about the role of the medical school and a significant opportunity that we have that has really at its infancy in terms of concept, but I think will play into what you heard from Senator Green. But I'd like to just make a statement that we cannot continue doing what we're currently doing now. We don't have enough funding, and we don't have enough providers to implement care in the way that it should be delivered. So how do we get there? What can we do collectively around that? You heard a little bit about the shortage of providers here in Hawaii, but it's not just here in Hawaii, it's a national shortage. In 2025, it's anticipated there'll be 120,000 fewer providers than what the demographics of the U.S. will require. So we cannot simply pull from other states to meet the needs of Hawaii. We need to be able to build programs here that will help us train, recruit, and retain physicians for our needs and other healthcare providers to help us deliver the healthcare that we need for the future. So, what can we do here through the medical school? Now, we can incrementally increase the class of the size for the medical school, and we've been working at that. However, that's challenging because our model needs to be addressed, and we also need to look at supplemental models that will help us leverage what we do have. It's an expensive proposition to train additional physicians, and there's a limit to how much we can do that. So can we create a more efficient model of training? I think we can.
I want to spend a few minutes today talking about some of the things that are being done right now. Specifically, I want to talk about the issues of cost and quality that everyone has talked about, the increasing costs, and the issues with quality. We recognize that at HMSA. We've been serving the community as a not-for-profit mutual benefit society for 73 years now. I'm proud to be part of HMSA, and we have embarked on a new direction to help solve these problems, and that's what we're doing right now. For example, we're working with our hospital network across the state on a brand new program. Now, historically, healthcare in Hawaii has been paid predominantly on a fee-for-service basis, and what that means is it's basically a piecemeal program. In other words, the more you do, the more you get paid. And you get paid based on volume, not value, and on quantity, not quality. Now, that's a terrible set of incentives for healthcare to be worked under, but that's the way healthcare has been reimbursed in Hawaii and across the United States for many decades. We're in the process of transforming that, and you didn't ask me about my word, Josh, but my word is transformation, so which is not quite transform, but it is transformation. We're in the process of transforming healthcare, and if you want to change behavior, you have to change incentives. So we're changing incentives, and what I mean by that is that we are paying hospitals and doctors now for how well they treat patients. We're paying them for taking care of a patient population. We're paying them for quality, safety, efficiency, reducing harm. That is the types of things now we're going through this process. It's not something you change overnight.
After this entire transformation takes place, the question is will we be satisfied? Can I actually practice under the model that is created? And to answer the one question that we'll all have to deal with maybe in about half a decade or a decade is, will you, I, your child, your parents be able to find a quality physician and be able to access treatment in a timely manner? You know, to give you a sense of what perspective I'm coming from, Josh has introduced me. I'm in solo practice. I practice at Queens. I'm involved with internal medicine, which is adults, and pediatrics. So I'm a little bit of a typical private practitioner here in Hawaii. I'm in a non-group practice. I'm located fairly close to a major hospital, but I'm also a dying breed. I'm actually a breed that may not survive this healthcare transformation because practitioners such as myself, despite the reimbursement that is being put in place, actually can't afford the overhead. And in addition to that, as Dean Hedges referred to, my young colleagues are choosing to go elsewhere. They're going out of private practice. They're deciding not to practice it within the state of Hawaii, much less the neighbor islands. Regardless of the problems that are going on, from my perspective, I think it's important that we, as we develop the models, as we come together, as we try to collaborate to make this system work, because it is that important and it is that lucrative, and it is, as Dr. Tsang say, a petri dish that if we do it right, it could actually work.
70,000 Americans who are 100 years or older today. By the year 2050, which is less than 40 years from now, that number will grow to 1 million. So there will be some of you in here who will be 100 years. I won't be there, but some of you certainly will be there. I'm going to share some statistics today, and you may challenge the validity or reliability of the statistics, but the magnitude, I think, is what you really need to be attentive to. And I'm really focusing on the Medicare population. So today there are about 45 million Americans who are Medicare beneficiaries. And historically they have been growing about 500,000 beneficiaries per year. And at an annual cost to the U.S. Treasury of about $600+ billion a year. So big numbers today, continue to grow. Now there are 77 million aging baby boomers, people who were born between 1946 and 1964. So some of you are in that group, and there are some who might be even older than that. But the fact is that there are 77 million people who are in that category, and the first year of those, in 2012, that leading edge turned 65, and that's next year. And so if you average the birth rate or the numbers per year between 64 or 46 and 64, that's about over 4 million per year. So the Medicare enrollment will increase substantially beginning 2012.
The two moderators, Ginny Presler and Josh Green, then formed a third panel to summarize the relationship between health costs and the quality of health care.
So that we can ultimately get to where patients and the healthcare providers are accountable, and that's the key word in the ACO, is the Accountable Care Organization, is the accountability, and that accountability needs to go back to the individual who is accountable for taking care of their own health. And with the technology that we have today and access to information, patients, all of you consumers, can in fact be accountable for your own health care. You have the information you need, and it's going to get easier to have access to that with the technology that's we're using these days.
From the perspective of value, it kind of harkens back to the numbers I dropped, kind of like a bomb early on. The fact that we went from 1.3 trillion to 2.6 trillion, a 100% increase in 10 years. I think that the American people are very aware more than ever about the impact of healthcare and healthcare reform after that. If for no better reason, whether you like the Affordable Care Act, Obamacare, or not, it did awaken awareness about healthcare and its impact and costs on small businesses, what it would mean to them, and so on. So it almost has gotten everyone involved. And now comes the hard work of actually implementing a valuable system.
The attendees were pleased with the program and were happy to say so.
Well, it's a very interesting opportunity to get people from the business community and the healthcare community on the administrative as well as on the clinical side together.
Very thoughtful questions, so I appreciated the opportunity to participate.
You know, the thing that I always enjoy when you see this level of engagement, people have stayed around afterwards to talk about it some more.
Lots of movers and shakers here.
You did a great job of assembling the right people, and then we're going to move forward with this.
This is only the beginning of a dialogue, right, of this many yet to come.
We had a good, diverse group of individuals speaking.
I enjoyed it. It was very thought-provoking.
Terrific program, great panelists.
Good information exchange. But I look forward to working with these folks.
It's an exhilarating feeling to see a group of smart thought leaders in Hawaii come together.
I'm personally a dentist, and I think there's, as the geriatric population is growing, there's going to be a lot of need for home visit dentistry.
I thought it was a terrific panel. I couldn't imagine bringing 8 or 10 people that are more attentive to our real healthcare situation.
Why not make us a model for the country? You know, we already have one of the lowest uninsured. We have one of the healthiest populations. Why not have a system that the other states are saying, why don't we do it like Hawaii?
The consumer's going to have some responsibilities. We're not letting them off the hook. But at the same time as we're designing a sort of a transformed healthcare delivery system.
I particularly liked the comments by several of the speakers on what they felt was necessary and what was going to happen in Hawaii.
I learned a lot, and I think it gave me a lot to think about.
I'm an internist. I'm from Mount Shasta, California, a very small town. And with Dr. Nadine, what she was saying is really the time with their patients. And we were losing that.
Insurance only covers 30 to 40%. What it means is most of the older people, when they reach 65, they are out of luck.
There wasn't enough time to answer all the questions from the floor. So we're setting up a radio show on ThinkTech Radio and KGU 760 AM for the moderators to continue the conversation and answer some of those questions.
One thing was clear. We're in a transformation in healthcare. It's both a challenge and an opportunity for Hawaii. But in either event, we all need to pay close attention to it going forward. Our individual health and the health of our economy and our community depend on it.
Thanks so much to our moderators and panelists, and to all the people who attended and participated in this program. This is the kind of program that ThinkTech is all about.
Now for our ThinkTech calendar of events going forward.
ThinkTech's 4 to 5 p.m. weekday drive time radio series on KGU 760 AM continues this week, covering business, Asia, tech, energy, the arts, and government. Tune in to 760 AM every weekday at 4 p.m. and raise your awareness on ThinkTech Radio.
On January 26, 2012, the Hawaii Venture Capital Association and ThinkTech will present the annual Deal of the Year Awards, celebrating the best deals of the year for entrepreneurs in Hawaii. Sign up for these programs on hvca.org. And now here's Bill Spencer, president of the Hawaii Venture Capital Association, with this week's Spensation.
Well, we did a number of interviews. We had Teresa Wong, who's a rehabilitation therapist. We had Janet Liang, who's the CEO of Kaiser, who's a very important player in this. We had John McComas from Aloha Healthcare, very important player. And we have significant interviews and comments from them. So when you take the program and then you add them, you get a pretty broad feeling about what's going on. And then, only yesterday, we had an interview with Barry Furrow, who teaches at Earl Mack Law School in Pennsylvania. And Barry is really a national expert in healthcare. He sits on some of these boards. His casebook has been cited a number of times by the Supreme Court of the United States in dealing with healthcare questions.
One of the things that pleased me about the program is that we had attracted a broad cross-section of the Hawaii healthcare community, which don't usually show up for our programs. The other thing that, there were some takeaway points, which one of the most astounding to me was that of the total healthcare budget in the state, in other words, all money that's spent on healthcare, half of that is funded by the state. So our tax dollars are paying for the Medicaid and a variety of services for which there are no other source of funds.
And our share is likely to increase
Absolutely.
as the federal decreases.
I think other things that were not really talked about, although they were referenced, was the grain population, the lack of long-term care beds. In fact, that's what from what I gathered from Bruce Anderson, that's what the state hospital system pretty much uses its beds for, as long-term care. So we have some real significant challenges that I think some entrepreneurial energy could address. I mean, you would think that docs are somewhat tech savvy and that they would embrace a technology that could potentially reduce their paperwork load, but it doesn't seem to be happening.
I think a lot of doctors are living in the age of Norman Rockwell. The paintings he did of medicine. It was always, so characteristic of the single practitioner in the country town. Well, that's really not possible anymore.
It's true.
Yeah. Thank you, Bill.
All right, thank you,
We're going
Jay.
to cover this going forward.
All right.
Can't stop now.
We'll be right back to wrap up this week's edition of ThinkTech, but first we want to thank our underwriters.
Thanks to the Scheidler Family Foundation, which supports a number of educational, cultural, and charitable organizations, including ThinkTech.
Hawaiian Electric Company and its affiliates Miko on Maui and Helco on the Big Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company, and CEO of CBI Polymers, a tech company in Hawaii.
Oceanet, another local tech company, is one of Hawaii's largest and most diversified science and engineering companies.
Okay, Alisa, that wraps up this week's edition of ThinkTech. Remember, you can watch ThinkTech on OC16 several times every week. Can't get enough of it, just like Alisa does. For additional times, check out oc16.tv.
You bet, Jay. For lots more ThinkTech videos and for underwriting and sponsorship opportunities on ThinkTech on OC16, visit thinktechhawaii.com. Be a sponsor. Help us reach Hawaii.
I'm Jay Fidell. Thanks for joining us on ThinkTech.
I'm Alisa Onishi. Aloha, everyone.